Good afternoon or good noon. All right. So I think everyone here is familiar with the limitations of patching, which range from poor adherence to still having residual amblyopia even after patching for a long period of time. There's probably a variable amount of knowledge here about luminopia. So luminopia, in my sort of clinician simpletons approach, uses a VR headset, but I stress to parents that it's not actually virtual reality. It's just using the headset so that it could present different information to each eye. And the idea here is really as an alternative to patching and drops. So what kids do is they put this on and they get to select from a very large library of curated content, which is coming from familiar providers like PBS and NIC, et cetera. And an advantage of this is that because they're wearing a headset, that this is presented in a sort of distraction-free environment. So they're completely focused on the content and not what's else is going around. One thing to note is that the headset over time has sort of been updated, and it's really quite lightweight. This may be brought up in the Q&A, but I haven't really heard that the headset size or weight is really an issue, even with younger kids. And the standard dosing that was used in the trials, and which I think most people are using, is to use it for 1 hour a day, 6 days a week. But we can talk about that in the panel. So you heard a little bit about this in talks yesterday, but basically what's going on is there's two basic mechanisms in the approach here. So the first is for the non-amblyopic eye to reduce the contrast in the image or the cartoon that they're watching. And if you lower it enough, it essentially turns off the suppression that's going on, and so the amblyopic eye starts to be used as well. Then the sort of second piece to this is to do masking, or in other words, drop out pieces of the picture from each eye, but in a complementary fashion, so that in order to see the whole picture, you really have to be using each eye. And these are cycled through every, is it 10 seconds, I think? 30 seconds. Every 30 seconds? So every 30 seconds, they change the mask. So it's not always the same. It's these sort of masked out parts or dropped out parts keep changing. And the road that sort of led to this being approved by the FDA included a number of trials. So there were first two sort of pretty large pilot studies that were done at 10 sites in the US. And this is open label studies. The patients ranged in age from age 4 to 12, so it included some older kids as well. And it was a total of 80 patients. And based on the success of those studies, a pivotal trial, a phase 3 randomized controlled trial was done. And I'll talk a little bit about the detail of that. So these were patients aged focused down to 4 to 7, as opposed to up to 12. And to be included, the amblyopic eye visual acuity had to be at least 20/40 and at worst 2200. And there had to be, for the lower ends, there had to be at least and in general, there had to be at least a 3-line or more interocular difference to the non-amblyopic eye. I think the original goal was 120 patients, but there was a pre-planned interim analysis, and the study outcome was met early. So the study was able to be stopped early because regardless of what happened after that point, it was going to be a positive result. So the study was stopped a little early because it met the endpoint quickly. So here's just a little more detail about that. The primary endpoint was at 12 weeks, so just 3 months. It's important to remember that when you're thinking about the effect size here. I already mentioned that the amblyopic eye was from 20/40 to 2200. And importantly, they were allowed to have up to a year of prior treatment. And it turns out that most of them did. About 85% had had prior treatment for amblyopia, in addition to glasses. I guess one last point there is, oops, I don't know if I can go back, but this was designed in discussion or collaboration with the FDA, and it was agreed basically that the appropriate study outcome was a comparison for a superiority outcome of Luminopia against glasses alone. And that was based off of prior amblyopia studies that looked at patching versus glasses alone, for example. So here are the primary results. So you can see over the 12 weeks, there was an increase in vision in the amblyopic eye that ended up at 1.8 lines. And this was significantly different from the placebo control arm. And the same effect, let's see if I can get it to go there, was seen whether they had been previously treated or not. So again, 84% of the kids had been treated, many for many months, and some all the way up to a year. There weren't any serious adverse events. The most common adverse event reported was headache, which was more common in the Luminopia group than the control group, but they were all graded as mild or transient, did not result in stopping the device. And since then, sort of redesign of the device and making it more lightweight, we think has helped with that. And overall, the rates of ocular adverse events were actually similar between the groups when you look at all the different reports. When they asked parents whether they like the device or not, 94% said that they preferred Luminopia over the patching in general and over the patching they had done previously. And one advantage of this device is that you can track compliance precisely. So it was known that there was about 85% compliance, which is probably more than double what we might expect even in a clinical trial from patching. This is the official FDA indications that have been approved. So it's for amblyopia. I'm just going to say them. So this is for amblyopia that's from anisometropia or strabismus. And it's for patients 4 to 7 years of age. You use it over the glasses, so they wear the device over their normal glasses. The device does, sometimes this question comes up, the picture that they're seeing is presented as if it's at distance. So they don't need to accommodate for this, but they do wear their glasses. And the indication is obviously to improve acuity, and it can be used both as first or second line treatment. The recommended dose is an hour per day, 6 days a week, but the actual duration and dosing is up to the provider, and that's us. It's actually very easy to prescribe this. You can do it in your electronic health record. We have Epic at CHOP, and it takes me about 40 seconds to do this. Everything's right. It's all just a preset order. I just fill in whether it's right eye or left eye and click another couple things, and it goes off to an electronic pharmacy called PhilRx, who then takes over and handles everything. And we could talk about that in a little more detail in the discussion as well. If you don't have an EHR or you don't want to set it up in there, then you can also fill out an enrollment form and fax that or phone it into the online pharmacy, the virtual pharmacy. But really, it's very simple and quick and easy to prescribe this from the doctor's point of view.